Are you recently separated or divorced and thinking about that revenge bod, or joining a pickleball group to meet people? Or maybe you're thinking about exercising to cope, maybe lifting weights. Listen in as Dr. Jason Robertson, a non-operative specialist, talks about how to go about getting all in without being done in. This is the Silver Divorce Podcast, broadcast from the Whitfield Media Group studios in Chattanooga, Tennessee, brought to you by our title sponsor, Center for Sports Medicine and Orthopaedics, and show sponsor, Medicare Misty. Center for Sports Medicine and Orthopaedics is the area's leading provider of multi-specialty orthopedic care. Using innovative surgical techniques and technologies, their team of specialists deliver exceptional results backed by exceptional patient care. Learn more at sportmed.com. Medicare Misty is a real person who can help answer your Medicare questions. Get real help from her team at medicaremisty.com. I'm your host, Lisa, and now let's podcast. Well, I am so pleased to be joined by Dr. Jason Robertson. He is a non-operative orthopedic specialist, and he also serves as the urgent care clinic director for the Center for Sports Medicine and Orthopedics. He has a unique role in that he also serves as the team physician for the Chattanooga Lookouts, which is a minor league baseball team, the Chattanooga Football Club, and the Chattanooga Red Wolves, which is a professional soccer team. So welcome, Dr. Robertson.
Thank you, Lisa. I appreciate being invited.
Oh, I am so glad you're here and that you took time out of your day. I know you are super busy, and it is so interesting. Our listeners may be wondering, why are we talking about orthopedics in a divorce podcast? But what I've learned is that it is very common for people who are newly divorced to go from perhaps that sedentary lifestyle, or maybe they went for walks with their spouse in the evening, but they may not have been into the hardcore exercise or working out. And sometimes then they want to obtain that revenge bod. That's when, you get in the best shape of your life to make your spouse jealous. Or they are invited to go join new sports. And I had this happen to me where a friend wanted me to come play pickleball, and I found out how demanding that is. And sometimes, though, they hit the gym and they want to start lifting weights, and they find that helps calm their mind. But what we know is that getting that revenge bod in your 50s and 60s is a lot different from doing that in your 20s. So I thought it would be great to have you on and talk about how do we get going? What are the smart ways to go about getting in shape again? And then also, some of the common injuries. What do we look for? And when do we get help from someone like you when we've pushed ourselves too far? So,
sure.
Yeah.
Well, I think to begin, I think the main thing that I talk to my patients about, and I say this pretty commonly in my patient interactions, is don't be proud, right? And so as you're beginning something anew or something afresh, sometimes there's a lot of energy and vigor and a lot of diligence and commitment to engage in that activity. And of course, you can get a lot of social benefits from being out and about and exercising, along with all the physical and mental benefits that we can see from exercise as well. But you've got to make sure you go about it slowly and cautiously, and that you don't forget about recovery time. So I'll typically recommend folks exercise to begin with no more than 3 times a week, and that they have a day of rest and recovery in between exercise time, and the ability maybe even to take an extra day to recover, and just make sure that all that soreness kind of gets worked out, and that you're not going to make things angry by doing too much too quickly without enough rest in between.
Okay, 3 times a week. That makes sense. I know myself, I have decided, I'm going to turn it up and hit it harder, and I'll go all out one day, and then I can't walk for 2 days. So that really makes a lot of sense. If I do have some pre-existing conditions, maybe I have asthma or high blood pressure. High blood pressure is very common in this older set. This podcast is for people who are 50 plus. And then diabetes also. Are there some exercises or sports I should avoid when I have conditions like that?
Well, depending on how well controlled some of those conditions are, you may not have any kind of restrictions. But sometimes, particularly with high blood pressure, you may want to be cautious about doing anything that really gets that blood pressure up relatively quickly. So a lot of like heavy lifting or high intensity exercise probably should avoid and stick with kind of low intensity exercise. And that would allow your heart to kind of recover just from the exercise and not to put too much stress on it. Mm-hmm. So I think it's mostly important to have that conversation with your primary doctor and to explain to them, hey, I am wanting to begin something fresh and new. What kind of guidance do I need based on my medical issues? And there may be no guidance, just to go about it very slowly and carefully. But in particular with high blood pressure, that's something to consider.
Okay. So is there something that would be safer to start out with as opposed to, maybe I've heard a lot about pickleball and about particular injuries related to that sport.
Mm-hmm. Yeah, low impact, low intensity things are always great to begin. Low impact activity would be walking. That still is impact, but it's low impact. Pickleball would be a low impact activity, which would be a great exercise to begin. And those would both be low to moderate intensity. You could kind of adjust your intensity level depending on how comfortable you feel physically and perhaps maybe what the recommendations might be from your doctor. Non-impact exercises are great. So a stationary bike, recumbent bike, an elliptical, a rowing machine, anything in the water, those would all be great non-impact exercises as well. But pickleball in particular has become extremely popular, really, I think, through COVID, where it was a way folks could be outside and still social distance, but still get the benefits of exercise and get that socialization where they could play with friends and have conversations together and laugh. And so I think pickleball is a great activity to consider as you begin an exercise routine. Common injuries that we see are going to be soft tissue injuries from, perhaps doing things too quickly without enough rest and recovery in between. But there'll be common soft tissue injuries of the calf muscle where you could actually tear or strain part of that calf muscle. You could even rupture your Achilles tendon where it comes down and attaches to the back of the heel bone. And then we'll see some issues with wrist and elbow and racket sports that are pretty common. Tennis elbow comes to mind where just with the gripping and the swinging of the paddle, you put a lot of stress on those muscles that help with your grip. Mm-hmm. And then, of course, traumatic injuries where there might be a stumble or a fall because you're kind of getting out over your feet a little bit too much or being too aggressive when you're playing. And I've seen, wrist and elbow fractures and even ankle fractures and foot fractures from those type of injuries.
So is there a way to know if I'm a higher risk for some of those injuries that maybe I need to be a little more cautious or take some extra precaution in warming up?
There are some things you could do, even working with a therapist on doing a functional movement screen, which will look at, muscle strength of kind of particular muscles of your hips and knee and ankle and your core. It'll look at flexibility of those joints as well. And then that can kind of give us an idea of, at-risk joints or at-risk muscle groups. And then a tailored program can kind of be created to help you for injury prevention. And so a functional movement screen is a great way to kind of have something that's tailored to you, that's unique and particular to you, to allow you to focus on some particular joints or muscle groups.
Oh, fantastic. Functional movement screen. Is that something where I can self-refer to that, or would I need to go to my primary care doctor first?
No, typically you're able to self-refer to a therapist for a handful of visits, and
Okay.
that's certainly, I think, something most physical therapists would be comfortable doing. But I think that's something that you'd want to ask if someone would be available to do that.
Okay. I'm going to keep that in mind. I think I might put that in the show notes too, a functional movement screen, just to determine where you are at risk for higher injury and to give you some perhaps strengthening. Would they give you some strengthening exercises and things that you can do to avoid injury?
That's right. They would give you kind of an individual tailored program to show you things that you could do to prevent perhaps foot and ankle injuries, or to perhaps prevent your elbow from getting overused and angry. And certainly they would help you with your core strengthening and glute strengthening to help with balance and prevent falls.
Oh, great. Fantastic. So, Jan, that also brings me to warming up and cooling down when you start to do some exercise programs. How important is that? What amount of time should we take doing that? And does that help to avoid injuries as we're getting started?
Certainly warming up is going to be helpful to loosen your joints up and kind of wake those muscles up to where they'll fire appropriately when needed. So I think that's really super important to spend, 15 minutes or so before you begin on a dedicated kind of dynamic stretching program or warm-up to get your heart rate up and just to get your muscles kind of warm. And you could do that with pickleball just by kind of dinking or hitting balls back and forth and not necessarily moving a lot or chasing the balls, and then work on some stretching or even just squats in a standing position. You could jog in place would be a good one that would be easy and simple to do. And those are all important things. And then I think it's important even after your exercise routine to go through a dedicated cool down period where you don't just stop that exercise, but you kind of taper it down slowly through some stretching and flexibility things as well. And that'll help over the long term with injury prevention.
Okay. Great. And then now that we're entering this cold season weather and you do still see some of the pickleball courts operating, are you at higher risk when it's colder, or should you alter your routine or maybe move it indoors as long as it's not snowing? What are your tips on that?
Right. Right. I think, you definitely have to be careful with, the court.
Yeah.
If the court is going to be wet, I would try to avoid playing on a wet court just because that slipperiness will increase your risk of a fall. This time of year too, after daylight savings time, it's getting darker a lot earlier as well. So, if it's going to be dark or you're going to be in those dusky times, it's probably best to play indoors so you're not going to be affected by your loss of sight or vision, because that certainly will put you more at risk to fall as well. And then with it getting colder, I think it is more important to dress appropriately and to warm up appropriately as well.
Okay. I've seen some great indoor pickleball courts being built, and it seems to be almost, exploding, just as the divorce rate is exploding among us. Older population, we're all somewhat gravitating toward a social sport like pickleball. So I thought it would be good to talk about that.
Got an injury that just can't wait? There's no need to delay your care. Center for Sports Medicine and Orthopaedics is excited to announce that our Urgent Ortho Walk-In Clinic is now available on Saturdays at the Gun Barrel Road location. Open from 8 to noon, we're here to treat sprains, strains, fractures, and more. No appointment needed. So skip the long ER wait and get specialized orthopedic care fast. Visit us this Saturday at Center for Sports Medicine and Orthopaedics Urgent Ortho. We're the center for expert care right when you need it. Learn more at sportmed.com.
Let's talk about if you do have an injury and if you do have a sprain, and how long do you wait? Do you apply ice or heat? And how long do you nurse things along before you should get some help?
If you have bony tenderness where you're sore on a particular bone, you have swelling, If it's of the lower extremity and you're kind of limping, then I'd say, hey, I'd try to get it checked out within the next day or two. If it's something where you're walking pretty normally, there's not a whole lot of swelling, you're sore maybe over the soft tissues, then I think it's okay to give it a week or two and just let things kind of calm down with some light stretching and modifying your activity, and then maybe reevaluate it and see how you feel after that. Mm-hmm. But if you're really struggling and there's a lot of swelling and bony tenderness, probably just need to get a quick x-ray and make sure everything looks okay.
Okay. And you can do that. Is that something where there are some of the walk-in clinics that you can get that done at, or is that something you would go to an emergency room for? What's the best direction for that?
Yeah, so that's kind of where I think our ortho urgent care or urgent ortho clinics or walk-in clinics really fill a great gap, where certainly that's not something that's necessary to go to an emergency room. But we have that specialized care where we can get you in that same day, get an x-ray, and have it looked at by folks who kind of look at those x-rays all day and take care of those injuries all day and really get you on a path to recovery most quickly. And so we can get you in that same day or certainly within 24 hours if needed.
Yeah. And I know a lot of times people hesitate because they think, oh, I'm going to go sit in an ED for 7 or 8 hours, or they think it's going to get better. I know I have done this myself, and you give it so much time, but what you're saying then is if you're limping or if it's a bony pain, don't wait. Just go ahead and come on in and let us get taken care of.
That's right. Just get it looked at. It's a quick, easy x-ray, and we have our urgent ortho clinics at our McCauley office, which is where I am 5 days a week, our North Georgia office, our Cleveland office, and we have kind of a new Saturday urgent ortho clinic that is going to be opening actually this upcoming weekend at our Atrium office, and that'll be open kind of every Saturday, 8 to 12, and so we can get you in relatively quickly. Of course, it's still going to take you an hour or so to get through the whole system, maybe a little bit longer, but we can get everything kind of taken care of, x-rays, bracing, splinting, and figure out what's going on, and then, get you back out there as quickly as possible.
Yeah, and I know we have listeners from all over the United States. Is non-operative orthopedic specialist, is that pretty common? If people want to, they've listened to this and okay, they know they need to look for somebody, they can just Google perhaps a ortho walk-in clinic. Is that what you would recommend?
Yes, they're becoming, I started here in Chattanooga about 18 years ago, and it was a unique position to be in then, and I was, I think at that time, the only person in Chattanooga with kind of in that situation. But now across the country, they've become a lot more common. Mm-hmm. And, an orthopedic urgent care is going to be common in most, mid-sized cities and probably even in a lot of smaller-sized cities.
Okay, so just Google orthopedic urgent care, and you should be able to find someone if you're not in the Chattanooga region where your offices are. That's good. So what did inspire you to go into it? You were kind of on the leading edge of non-operative orthopedic specialists. What inspired you?
Injuries.
Injuries.
So I think that's what really kind of piqued my interest as a young child. I was an athlete and loved playing sports and loved kind of being around sports teams. And, back then, of course, you didn't really specialize when you were younger. And so we played all sorts of different sports through all seasons. And then I played soccer in college at Lipscomb University and really just fell in love with sports and sports teams and being out there and being active. And through that process, I had a couple of knee surgeries and ankle surgery, multiple injuries over the course of time. And so was introduced to sports medicine, orthopedics at that time, and had a couple of good mentors along the way. And went on a medical mission trip to Guatemala as a young college student and fell in love with medicine at that time. And then through all my history of injuries, just kind of gravitated to sports medicine.
Okay. So I'm sure you've seen a lot of inspiring stories where you've treated somebody that had an injury and brought them back. Can you share, do you have any that come to mind that you could share for some of the athletes?
Oh boy. There are lots probably over the years, and if you've been in my office, you'll see some of those stories, those kind of testimonies in pictures that are hanging on the wall and on jerseys that are hanging on the wall, or helmets or bats or boxing gloves.
Yep.
And so they range from, I can think, and just going through pictures in the room where a middle-aged woman who broke her personal record in a marathon after she struggled through an injury during her training. And she was so grateful for me to help her get through that she sent me a picture of her with her medal at the finish line. I have a football player's jersey, and I can remember him going through his senior year and injuring himself at the beginning of the year and just in tears and emotional about that, and me helping him be able to get back to play at the end of his senior year. But, those are stories that I see pretty consistently on a daily basis just with the patients that I take care of. And it's something that I love, and you see a lot of trauma. Of course, I have to give, bad news to lots of folks where, they're done with their season, but I also get to help see a lot of successes where you can see kids and adults alike achieve goals. And I get to work with a lot of people who are committed to getting better and doing well and looking after their health. And so that's why I love it.
Yeah, it has to be satisfying. So from what I hear you say, it's not too late if you are 50 or even maybe 60 and you want to start in a sport. It's not too late. You can eventually run that marathon. Is that what I hear you saying?
Absolutely.
Yeah.
I would say that most marathon runners start as they get older.
Really?
But something that you kind of gravitate towards as you become kind of a young adult, and then it becomes kind of a social interaction where you're meeting with groups of runners, and you're having meetings at running clubs, and you'll find folks of all ages in those clubs. And so it's not just for the running, it's also for the benefit of just being in the community with people.
And that's the best thing about sports, really, is the social interaction and being part of that community. So that's great. Well, if I am looking to start, I'm understanding that you might want to start with that functional assessment, make sure that you're stretching, taking care of yourself. If you do have an injury, don't wait, get seen. And it's possible to go out and run those marathons.
Mm-hmm. Slow and steady wins the race.
Sounds like
right.
it.
So
yeah.
The general rule of thumb is don't increase your mileage, your intensity, your time of exercise more than about 10% per week. And so that's a very, very slow progression. But that helps to avoid doing too much too quickly. And it enables your body to kind of catch up and recover and heal those tissues that get damaged during exercise.
Okay. So if I wanted to ask you, as a non-operative, what are some of the conservative treatments that you do recommend for people?
So after injuries, soft tissue injuries in particular, oftentimes early motion is something that's important. And so, probably the most common injury that we'll see in our urgent cares is going to be an ankle sprain, a traditional ankle sprain. And so we know through the literature that early motion is a way to get those athletes back to their sport most quickly and most safely. Now, of course, sometimes folks need help with pain control and taking pressure off the ankle. So sometimes they might need to be in a boot or on crutches. But as soon as they're able, we try to get them into physical therapy and start on a good program to get that ankle strong again. And that's what's been shown to get them back to their sport.
Okay. Yeah, I bet you're watching the Chiefs and their quarterback. He's been having his ankle injuries, and they're never quite sure if he's going to make it through the game. And he gets right back in there and keeps going. And I know you serve as a team physician for minor league and professional sports teams. So could you just share with our listeners your role and how you keep them active and in the game?
Sure. So certainly, and with each sport, it entails kind of a different thought process, a different kind of knowledge base to know, what injuries are most common, what do folks need to be working on preseason. But I think it begins now. All of those teams are in their off season now. And so all of those athletes, as I met with them when the season was over through their exit physicals, I talked to them about rest and recovery, about just taking, 4 weeks off or so just to let your mind have a break, let your body to have a break, and then begin particular programs. For the Chattanooga Lookouts as a baseball team, they're going to begin a good throwing program coming up over the next month or so, working on cuff strengthening, working on, scapular stability, core strengthening, hip strengthening. And then they'll go through a throwing program this winter, preparing them for spring training. Our soccer teams are going to be working on different muscle groups, but I had the same conversation with those athletes about rest and recovery, and then they'll be working on core strengthening, hip, adductor and abductor strengthening, because their injury profiles are a little bit different, where they have a lot more lower extremity injuries, particularly around the hips and the knees, than, of course, baseball players do.
Yeah.
But my role during the season is trying to keep them healthy, but also protect them to allow them to kind of reach their, maximum improvement before they get back out there, because all of those seasons are relatively long. And for the most part, about 40% of the athletes during any particular season will deal with some type of an injury. And so I'm there to help them get through that process through the season.
Well, that has to keep you very busy then with all the sports teams that you're working with. You must really love helping those players.
I do. Now it's kind of my time to recover a little bit as well, although just in general practice, it stays pretty busy until the end of the year, and insurance deductibles and things start all over again.
Oh, right. Yeah, people will avoid getting help when January comes. They're going to want to wait.
Right.
But in
That's
December,
right.
You can't catch a breath because you're so busy.
Right. That's right.
Yeah. Well, I appreciate you joining me today. Is there anything that you think is important for us to know that I haven't mentioned?
No, I think just as we get older in general, it's important, especially I feel like the age that we are in history and just where we are in history, is that community building is great. That's going to be healthy for you individually. It's going to be healthy for just us as humans. And so any way you can exercise and build community is going to be a great thing. And so I just encourage everybody to get out there and find people who you love and care about and enjoy their company and move and stay active.
Yeah, that's great advice. It really does help you cope with the trauma that you're going through in divorce, helps relieve stress, manage all of your emotions. So I found it to be very important. And then get help. Don't suffer along if you have an injury. Seek out an orthopedic sports clinic, urgent care clinic, and get help right away so you can get back in the game right away. So thank you, Dr. Robertson, for joining me on the Silver Divorce podcast and also for sharing your expertise. I appreciate it. For our listeners,
I enjoyed it.
Oh, good. For our listeners, please join us on the next episode and hit that subscribe button. We welcome your feedback. You may email us at silverdivorcepodcast@gmail.com or join our Facebook and Instagram pages at Silver Divorce Podcast. Also, please leave us a rating and a review. It does help us to grow this podcast and attract great guests. And I thank our title sponsor, the Center for Sports Medicine and Orthopaedics, and show sponsor, Medicare Misty. Center for Sports Medicine and Orthopaedics is the area's leading provider of multi-specialty orthopedic care. Using innovative surgical techniques and technologies, our team of specialists deliver exceptional results, backed by exceptional patient care. Learn more at sportmed.com. And Medicare Misty is a real person who can help answer your Medicare questions. Get real help from her team at medicaremisty.com. Whether you are considering divorce or you are newly in the divorce process, we're here to help you in that journey and tell you things your attorney might not tell you. Until next time, remember, divorce is one event. It does not define who you are. I'm Lisa, and I'll see you next time.